this is Andrea Kane here with Medical Terminology, HSC 114 at Northeast Iowa Community College. We are studying The Language of Medicine, 12th edition by Davie Ellen Chabner. And we are now halfway through week 5, working on chapter 9, which is the male reproductive system. Chapters 8 and 9 make up week 5, and so here's the last half of that. Our chapter goals are really unchanged. We want to make sure that we understand the functions of the organs of each system that we do, any abnormal conditions. We'll be talking about sexually transmitted infections in this chapter. We will talk about combining forms as always with prefixes and suffixes, lab tests, clinical procedures, related abbreviations, and we want to make sure that you know medical terms in their context. So let's get started. The male sex cell is called a spermatozoon or a sperm cell. So it's probably easier to refer to it as a sperm cell, but it's a spermatozoon. This carries with it its nuclear hereditary material or chromosomes in its head region. And then it has a tail, which is called a flagellum, and that makes the sperm cell mobile. And as we go further, we'll see some illustrations. Only 1 out of 300 million sperm cells released during ejaculation can fertilize a single female ovum. It's a 1-to-1 relationship, a 1 sperm cell to 1 ovum. And in a typical ejaculation, a male can release 300 million sperm cells. If there is more than 1 egg present in the fallopian tubes during ejaculation, then you could have multiple fertilizations. Twins that result from the fertilization of separate eggs by separate sperm cells are called fraternal twins. Twins that result from the fertilization of a single egg by a single sperm that divides 1 extra time at the beginning are called identical twins. So that's the difference. Fraternal twins will each be in their own amniotic sac. Identical twins will be in the same amniotic sac. Organs of the male reproductive system are designed to produce and release billions of sperm cells throughout the man's lifetime. And the hormone called testosterone is what is responsible for male bodily characteristics. Some anatomy terms that we will see through this study are testis, scrotum, perineum, seminiferous tubules, epididymis, vas deferens, seminal vesicles, ejaculatory duct, urethra, prostate gland, vocal urethral glands, penis, glans penis, and prepuce, also known as foreskin. So here is a view, a lateral view, a sagittal view, for those of you who are remembering back to those terms, looking from the side. The front is the anterior, the back is the posterior. You can see the structures. And this just points out what all of those are. And as we talked about in the last chapter, you can see where the urinary bladder is and how at the base of that urinary bladder is the prostate gland. And we talked about how that prostate gland sometimes decides to grow and squeeze that urethra and causing a backup of urine. So this just gives you another visual from the side of that situation. This also shows you the path, the tubes and tubules and those types of things that the sperm will go through. And we'll talk about that a little bit further, a few slides on. So what is the internal structure of the testis? One testis, and the epididymis. This gives you an idea of, okay, you start at the top with the spermatic cord. Within the spermatic cord are your testicular arteries and veins. Well, one artery and many veins, I guess you could put it, you could say. Then you have what's called the vas deferens, and that leads into the epididymis, which connects to the testis, which includes the seminiferous tubules. So you've got that. I like this visual better because for me, I'm more of a process flowchart person, and this helps me see the order of things. So the sperm are formed in those seminiferous tubules. They move through the epididymis, the vas deferens, and the ejaculatory duct till they get to the urethra. At the urethra, you have the prostate gland and the Cowper glands getting involved, and then the sperm at that point go into the penis and can leave the body. So some terms: bulbourethral glands, also known as Cowper glands, ejaculation, ejaculatory duct, epididymis or epididymides, erectile dysfunction, flagellum, fraternal twins, glans penis, and identical twins. And this gives you the definition for Siamese twins, which are identical twins that somehow never break into two distinct embryos. They're attached in some way, physically. Interstitial cells of the testes, parenchymal tissue, penis, perineum, prepuce or foreskin, prostate gland, scrotum, semen, seminal vesicles, seminiferous tubules, spermatozoon or spermatozoa. So if it's plural, it's spermatozoa. Sterilization, stromal tissue. Testis or testes, if it's plural. Testosterone, vas deferens. Which term refers to the skin that covers the tip of the penis? This also means foreskin. Hint, hint. All right, combining forms. You remember our equation. We have a root plus a combining vowel to equal our combining form. We have andro, balano, cryo, crypto, epidimo, gono, hydro, orco, orchio, orchido. Watch out, there's three there, and they all mean testis or testicle. Pino, prostato, semino, or semini. Watch out for this one because it is not an O, it is an I. Semini. So make a note of that. Spermo, terato, testo, varico, vaso or vaso, zuo. Oh, now we're into suffixes. Let me stop for a sip here. Genesis, own, pexy, stomy. All right, so what can go wrong with the male reproductive system? There are quite a few things. Again, it's based a lot on structure and on the organs themselves. So let's talk about it. When it comes to testicles and that structure with the testicles, the spermatic cord and all of that, there is something called a hydrocele that can develop, a sac of fluid in the scrotum. There's something called testicular torsion, where the spermatic cord gets twisted. This is extremely painful and can sometimes happen to young or adolescent young men. And when this happens, because it is twisting, it is also twisting the artery and the blood vessels and the veins in there. And so urgent, emergent medical care needs to be done to save the testicle. Otherwise, there's nothing to do except remove it. So if there's a young boy or young man who has who is suspected of having testicular torsion, they need emergency medical care. A varicocele is a dilated spermatic veins. Those veins enlarge for whatever reason, and that needs to be addressed pretty quickly as well. We talked about the prostate gland. You can have benign prostatic hyperplasia where it grows and grows and shrinks that urethra and constricts it. You can also have prostate cancer. And prostate cancer can be anywhere in the prostate gland. Some prostate cancers are very slow growing. Others are more quick growing. Hypospadias, this is a procedure, or I'm sorry, this is a condition where the opening of the penis is actually on the underside, and so there has to be a surgical repair done that basically pulls the foreskin back so that that opening is available to be utilized. This often happens, this is often noticed at birth. STIs, sexually transmitted infections. Chlamydial, gonorrheal, herpes genitalis, HPV, human papillomavirus, and syphilis. Those are probably the most common, and these are the ones that the book is talking about in this chapter. There are lab tests such as the PSA for the prostate. They also do quite a bit of semen analysis. If someone is unable to conceive naturally, sometimes they will do an analysis of the semen in the male to identify what is going on. Is there a low sperm count, or is there some other kind of malformation, an infection? Is there some kind of issue or obstruction? All sorts of questions get asked. Oh, and I just gave you this one, so to speak. What does the PSA test for? Well, it tests for a level of something having to do with the prostate, and I will leave it up to you as to which one that is. And we talked about TURP, transurethral resection of the prostate, and about how that's done with a scope. You go in and you essentially destroy the tissue of the prostate in this process to open up the urethra so that there's adequate flow and the bladder doesn't get backed up or infected. Vasectomy. This is a procedure that a man might go through if he chooses not to want to be fertile. So this shows you where they go into the vas deferens. They make a tiny incision and they go in, they cut and block the vas deferens. So it stops the sperm from going through the process and coming through the prostate and then going out through the penis. Which term means removal of the prostate? This should be a really easy one. Okay, some abbreviations. These are abbreviations you might run into when you're talking about the male reproductive system. And some of these you might run into with the female reproductive system too, if you think about pelvic inflammatory disease or the sexually transmitted infections. Okay, combining forms. Remember our formula or our fancy equation of root plus its combining vowel equals combining form. Andro, Bolano, cryo, crypto, epididymo, gono, hydro, orco, orchio, heno, prostato, semene. I don't know why I want to keep calling it semino, but it's semene. Spermo, terato, testo, varico, vaso, zuo. And then some suffixes, genesis, own, like hormone, own, hexy, stomy. Which term means no sperm or semen are being produced? None. And the difference here is not scanty. It's got to be none. What is that prefix for none? Or that root for none? Okay, that's it for the male reproductive system. We flew through that in record time. Hope you're doing well. Have a great rest of the week, and we'll be back next week to talk about Chapter 10, the nervous system. Take care.